This recording will go over therapeutic index, half-life, and pharmacodynamics. So the therapeutic index describes the relationship between the therapeutic dose of a drug and the toxic dose of a drug. Medications with a high therapeutic index, sometimes called a wide therapeutic index, have a wide safety margin. Therefore, there is no need for routine blood medication level monitoring. Medication with a low or narrow therapeutic index require close monitoring of the medication levels. So just to illustrate the difference between a medication with a high therapeutic index versus a low therapeutic index, let's imagine we have a medication with a high therapeutic index, and the therapeutic index for this medication is 5 to 100. All right, and so I added here some lines. So here's 5 and here's 100. So this medication has a wide safety margin, a high therapeutic index. It has a decent amount of range where the medication can be therapeutic and not harmful to the patient. So if this medication is below 5, that means there's not enough medication in the blood to exert its effect on the body. If this medication is above 100, that means there's too much medication in the blood, and we worry about accumulation and toxicity. When the medication is between those two numbers of the therapeutic index, that's its sweet spot. That's where it is concentrated enough to be effective and not dangerous. So that's where we want it. So this medication, there's a big area, a big range here where it can be safe and effective. Now we'll look at a medication with a low therapeutic index. So this medication has a therapeutic index of 0.8 to 2. So here's 0.8 and here's 2, right? So just like the other one, anything below 0.8, the medications, there's not enough medication to exert its effect to be therapeutic for the patient. Anything above 2 would be considered toxic for the patient. And then this little window is the sweet spot. So you can see here for this low therapeutic index medication that it has a narrow safety margin, because it's just this little sweet spot where that medication is going to be therapeutic without, again, too much. It would be toxic, not enough medicine to be therapeutic. Half-life refers to the time for the medication in the body to drop by 50%. Liver and kidney function affect half-life. It usually takes 4 half-lives to achieve a steady blood concentration. If a medication has a short half-life, it leaves the body quickly. With a medication that has a long half-life, the medication leaves the body more slowly. And this half-life explains why you might take one medication 4 times a day, and another medication once a day, right? Because of half-life, because of what it takes for that medication to achieve a steady level or a steady blood concentration in the body. So a medication with a short half-life, the patient might take more frequently, a longer half-life less frequently, and again with a longer half-life, there'd also be a greater risk of medication accumulation and toxicity. Pharmacodynamics describes the interactions between medications and target cells, body systems, and organs to produce effects. So while pharmacokinetics was the movement of medications throughout the body, pharmacodynamics is how the medication actually affects the body. Medication may have primary and secondary effects. A lot of times when we talk about this, we talk about diphenhydramine, which is Benadryl. So I have some sort of allergic reaction, a rash going on. I take my diphenhydramine to treat my rash. That would be my primary effect. My desirable response is that it makes my rash go away. My secondary effect can be desirable or undesirable. So I have a rash first thing in the morning, I take the Benadryl and I become drowsy, which is a secondary effect. That's undesirable for me at that point in time, as I just started my day. The secondary effect can become desirable if I'm taking the medication at night, or if I'm just taking the medication for that secondary effect to help promote sleep. Agonists and antagonists are terms that you need to be familiar with. I'm going to start with antagonists. When you see antagonists, you need to think blocker, right? So just get those in your brain as being the same thing. An antagonist is a blocker. Most of you have heard of beta blockers, right? That's blocking a beta receptor site. Sometimes they're called beta antagonists. So those can be used interchangeably, and you need to understand that. The opposite then would be an agonist, where an antagonist blocks a response or receptor. The agonist activates the receptor and produces the desired response. And then finally, partial agonists can act as agonists and antagonists with limited affinity to receptor sites. So let's look at this slide. Bethanacol is a medication used to treat urinary retention, right? So it stimulates urination. Bethanacol works on the cholinergic receptors to stimulate them to increase bladder contraction, right? To help treat urinary retention and promote urination. So if bethanacol is a medication that's working on that cholinergic receptor to stimulate urination, is it an agonist or an antagonist? Right? Bethanacol would be a cholinergic agonist because it's actually activating that receptor. All right, looking at this slide, we have epinephrine, which works on the receptors alpha 1, beta 1, and beta 2. Here's the responses that it causes. So epinephrine activates these receptor sites or works on these receptor sites to create responses. Is that considered an agonist or an antagonist? That would be considered an agonist because it's activating the receptors to produce a response. So let's say if the drug here listed isn't epinephrine, but it's atenolol, which is a beta blocker. And what atenolol does is it blocks the beta 1 receptors, and it results in decreased blood pressure and decreased heart rate. So would atenolol, which is blocking the beta 1 receptor to cause a response, be considered an agonist or an antagonist? Right? Atenolol would be considered an antagonist, right? Get those two, write them out together until you get them memorized as being the same thing. Atenolol would be an antagonist because it's blocking a receptor to produce a response. Next, we're going to talk about onset, peak, and duration. Onset is the time it takes for a drug to reach minimum effective concentration. So think of it with insulin. Your patient's getting insulin for their diabetes. The onset would be when that insulin starts to actually work and starts to decrease the patient's blood sugar. Peak is when the medication is at its highest concentration in the blood. So here's my crudely drawn mountain. When you think of the peak of a mountain, it's the highest point, right? The peak of a medication is when it's in its highest concentration in the blood. So in terms of insulin, the peak time for insulin would be when insulin is at its highest concentration in the blood, working at its fullest, and that's when the patient would be at risk to have a low blood sugar, right? Because it's the highest concentration of insulin working, so it's doing its job like it should. So if we're worried about a patient having low blood sugar after insulin, we'd want to watch them during that peak time. And we know when we look up these medications, we can find out that information. When you're going to give an insulin, you can look and see when the onset is, when the peak is, what the duration is. And finally, duration is the length of time it takes for a drug to exert a therapeutic effect. Once steady state has been achieved for a medication, drug concentrations can be determined by measuring peak and trough drug levels. Peak and trough levels are requested for drugs that have a narrow or low therapeutic index and are considered toxic. The peak drug level is the highest plasma concentration of drug at a specific time, and it indicates the rate of drug absorption. If a peak drug level is ordered, a blood sample should be drawn at the appropriate peak time based on the route of administration. Most drugs only require trough concentration levels to be drawn. The trough drug level is the lowest plasma concentration of a drug, and it measures the rate at which the drug is eliminated. Trough levels are drawn just prior to the next dose of drug, regardless of the route of administration. So to understand trough, let's think about vancomycin, which is an antibiotic that's commonly used. So your patient's getting IV vancomycin. and the doctor has ordered the trough be drawn every so often so that they can monitor the blood level of vancomycin in the patient. So the vancomycin's normal trough level is 10 to 20, right? So normally it has, we'll just say this is 10, this is 20, this is where its trough is normal. This is where we'd want that lower level of medication to be. If the medication trough level was below 10, then we'd know that the medication isn't in the blood system sufficiently to be therapeutic. If the medication was above 20, then we'd know that the medication there's too much medication in the system, and we'd worry about toxicity, right? Because if we're starting before our next dose with too much in the system and then we're given more, when our peak normally is here, right? We're starting at a higher level, our peak's going to be higher, right? And we're going to have toxicity. So the trough gauges the lower level of concentration of medications. It is drawn, a blood drawn immediately before the next dose of medication, right? It's the lower level, so it's right before a dose. And if the trough is off, if it's not correct, then we notify the physician and they may change the frequency or amount of medication that they've prescribed. So some terms related to pharmacodynamics that we need to understand: side effects or secondary drug effects. We talked about diphenhydramine, which I took to treat my rash, and the side effect of that would be drowsiness. Adverse reactions are usually more severe than side effects and are considered undesirable. And then drug toxicity is a drug level that exceeds therapeutic range. Drug interactions result when more than one medication is taken at a time, which alter the drug effect due to interactions with another drug. They can cause changes in absorption, distribution, metabolism, and excretion. Food may increase, decrease, or delay drug responses. So it's important when we're learning about these medications to understand how they need to be administered and to make sure our patients understand that. If the patient has a medication that needs to be taken on an empty stomach, they need to be aware of that so that the medication is absorbed correctly. If they're taking it at breakfast or after eating breakfast, right, that food affects the absorption and it affects how the medication is going to work in their body. Drug lab interactions. Drugs can cause misinterpretation of test results. Drug-induced photosensitivity. So photosensitivity is skin reaction caused by sunlight exposure. So just some terms you want to be familiar with. Pharmacogenetics is the study of genetic factors influencing individual response to medication. So there are genetic factors that'll influence how a patient responds to a medication. Some other terms worth noting: tolerance is a decreased drug responsiveness over time. Placebo effect, drug response not attributed to chemical drug properties, which most people are familiar with that one. And finally, tachyphylaxis, an acute rapid decrease in drug responsiveness regardless of time.